Hi, everyone. All right. Hi, August, please. Adejoke, hi. Welcome. Sorry, I'm trying to let everyone join in as much as possible. Queen Coris, good evening. Hi, everyone. Thank you for joining. Toba, Collie Log, Queen Coris. Hi, how are we doing? So, as usual, good evening. As usual, I'm not going to take all our time, and we are going to finish on the dot of 6:30 because, as usual, I don't like to waste time, and I know we are very busy people and we have a lot of things to do, so we'll just dive right into it. So, thank you so much, everybody. So, August is the month where all over the world people talk about hair loss, alopecia, discussing the issues surrounding alopecia in men and women. And August is just the month that is dedicated specially to alopecia, raising awareness for alopecia. So discussing in continuing our live sessions that we started since about 4 or 5 weeks ago, I decided that the month of August we are going to talk strictly about alopecia. Now, last week we talked about what alopecia is, what it is not, the people it can occur in, and I'll just do a quick recap because I realized that some people still, there's a couple of people still ask me that, what is alopecia? I think it's just the word that is like confusing, but I understand that we are busy people and sometimes we have too many things to do. Some people do not, and please, when I make posts and when I post videos, please read the captions, read the post for every single thing. I try to include a tip or two that helps. So it's very important, please, so that we should not just be posting content unnecessarily, posting, and people are not reading, please. Apart from the fact that it can be discouraging because we do our best. I want to do my best to leave free tips and everything. But it also saves your time too because you won't necessarily have to now start typing, what is this, what is that, what is this, what is that, and everything. And then knowledge is not free. All the free tips that you get, anything you want to get outside of that, it will come at a cost. So please, before you now, there are some things that some people will just, they could have easily known if they were following the free tips and all. But so please, I'm just enjoining us to like read the captions when we post videos, when we post make posts. Please read them, please listen and everything, so it will help us. So now back to the gist of the day. What is alopecia? Alopecia is simply the medical term, or not, is the medical term for hair loss. Hair loss of any form at all is called alopecia. Is a medical term for hair loss. Hair loss of any kind. Oyin Mokeji, welcome. Thank you. So, alopecia is the medical term for any form of hair loss. Now, when we say hair loss, what does hair loss mean? When hair loss simply means when your hair has fallen out and it has not been, and the hair that is meant to be replaced refuses to regrow. That's what you mean by hair loss. Now you find out there are some people that when you see them, you see that there's obviously no hair on their heads. Maybe some people that are bald, or maybe that have some form of damage to their edges and everything, and you see that this hair is definitely not growing back. Somebody like that is suffering from hair loss. That is what we call hair loss, because the hairs that were supposed to have regrown refuse to regrow. So it is just simply that. It's as basic as that. Now, I do not want us to confuse. I'm doing a quick recap of what we said last week. I don't want us to confuse it with hair fall. Hair fall, on the other hand, is the basic regular shedding that every hair must shed. Our hair has a life cycle. It has the growth stage, it has the resting stage, it has that cycle, the anagen, the catagen, and the telogen stage. That cycle of when it begins to grow, when it's growing out, and when it sheds and then replaces itself again. Once that cycle is terminated, once that cycle repeats itself, that is when you see that your hair is growing. That's why some people will be like, no, if you, some hairdressers say, when you make your hair, don't worry, mother. And you tell them that this Ghana weave, are you sure it's not cut? My, they will tell you, don't worry, it will regrow. The hair will regrow. Yes, it's not like the hair will not regrow, but after a while it might not regrow again, depending on how severe the damage has been done to the hair or not. So that's why we generally will tell people that you don't want to play tinko with your hair or your edges. So don't disturb the edges and just generally leave the hair to rest by itself. So that life cycle of the hair growth, when the life cycle when the hair is in the stage where it should shed, you understand, when it gets to the stage where it should shed, that particular hair, the way you know it is, most of those hairs, when you remove them, there are some hair that you check the strand, you see a whitish thing at the base of the hair strand. That particular hair has expired, quote and unquote. It has run its cycle, it has run its life cycle. And for it to have come out like that, it has been replaced inside the hair follicle. So you don't have anything to worry about. That kind of hair is very normal. It's very normal. But because, of course, we comb our hair, we discard it, we don't really pay attention. So we cannot really track how it is and everything. But if you are the type that is very meticulous and you can track, you'll be able to judge, okay, you will see that what you are saying is actually accurate, or whether it is accurate or not. Ideally, the average person should shed about 50 to 100 strands of hair daily. So if you look at it, that means 50 to 100 means you will fall within the range of that 50 to 100. It could be more, it could be less. But when it begins to be more than 100, that is where you begin to be worried. So when you see the hair and it's the regular shedding, you are not worried. You'll be like, okay, this is not a problem. And then basically the sign that you know is that where that hair has fallen out from, you would have observed that the hair has regrown. That is the reason why when you comb your hair most times, or when your hair falls out, you will see that you are just worried about the one that you are seeing outside. But if you look at your hair, there is no obvious sign of hair loss. Now, when your hair is obviously lost, that people can see that something is wrong with your hair, something is very wrong with your hair, trust me, you have lost about 50% of your hair. You have lost about 50% of your hair. For your hair to be very visible and for people to see that there is hair loss happening in this person's hair, you must have lost about 50% of your hair. It is an unfortunate fact and sad, but that is just the state of hair loss. Now, having said all of that, that is what hair loss basically is, what alopecia means. So it is not a over the top word, and then when you hear someone say alopecia, please know it this day that what it means is just simply hair loss. So now, having said that, it occurs in both men and women. Let us not have it confused that it's just women that suffer hair loss. No, men and women suffer hair loss. In fact, the only thing is that because society has conditioned us, or we've come to see that the hair is the crowning glory of the woman, so we associate long hair and full hair more to women. That's why when men lose their hair or go bald and all that, we don't generally see it as an issue. Or some men will begin to, their hair has begin to fall off and they are beginning to lose their hair. Most of the hair loss can be reversed, but because they'll be like, please, shebi I'm a man, let me just leave it. Then they leave it, and the more you leave the hair in that state, the wider the worse the hair loss becomes, and then the harder it is to get treated or for the hair loss to be reversed. So you want to be intentional about the fact that if you observe something that is funny that is happening to your hair, reach out to an expert, please. An expert in that field is usually regarded as a trichologist or trichologist. Either ways, you can pronounce it either ways. So please, you want to be sure that when you notice something funny with your hair, you immediately seek advice. So I'm going to definitely come back to the things that you should look out for. But I might not talk about it now. I'll talk about it in the next video, because as I said, I want to make it as I want to be as time conscious as possible. Tefle, Sila Point, thank you. Oluwashola, Start Small Doctors, thank you so much everyone for joining. All right, now bringing us to the talk of today. So what are the kinds of alopecia? What are the kinds of hair loss that are out there that we that can occur, that can happen to an individual. So generally, we'll classify all the kinds of hair loss that are available under two types. There's a general classification that I can put them under. We have scarring alopecia and non-scarring alopecia. Now, I'm not going to talk about all of them because they are a bit much. So I'm going to talk about the ones that are most prevalent, that are most common amongst people, amongst our kind of people, amongst people generally. So the first one I'm going to alopecia refers basically to that type of alopecia or hair loss that is inflammatory and destroys the hair follicles. It will destroy the hair follicles such that the follicles become tissued. It becomes fibrous. What it means is it becomes tissued. The follicles become closed up and damaged such that hair cannot grow out of it. Now, a simple example, and this is no offense to people that are bald, because that's like the easiest example that I can use to that I know that a lot of people will be able to relate with. When you see that place that is bald, totally bald, and is already shiny, that place is already tissued. That means the follicles are already damaged such that the hair that is underneath, that is meant to grow out of it, cannot pass through. That is what it basically means. Now, you will find that there are some women, when you look at them, you will see their edges, that there's something funny that is obviously happening around their hair. You will see that, this person's hair has gone. Most of them, they refer to them as Iyamileko or Iyeko, or those are the examples of people that comes to my mind that you can easily relate with. Hey, Auntie Etunde Jegede, thank you so much for joining. So those are the people that I can easily use as examples for you to relate with. Now, you see those places that you see that are already shiny, and most of them are even inflamed. You will see the funny things happening. Some of them might even be discolored. Those ones, they are the types that we call scarring alopecia. That's the umbrella word for them. Now, under this scarring alopecia, we have different types of alopecia, that we still have different types under it. As I said, that's the general one. Now, a most common one is the Ccca alopecia. Is the central centrifugal cicatricial alopecia. Central centrifugal cicatricial alopecia. This type of alopecia, if you are very familiar with videos that people post, most hairstylists post that based in America, you will see a lot of this type of alopecia. This is the way it presents. You will see it happens mostly in these women. It happens mostly in the center of their head. It has a circular motion in the center of the head. You see it's shiny. There is no hair there. Most times, the triggers for this kind of alopecia, what causes this alopecia mostly is, number one, the use of hot combs. The use of chemical relaxers. Then another thing, the use of bonding glues. God, I have seen so many cases of women that hair loss just started with something small. Okay, one of the people that I've come across, she went to make a particular style. God, no. I'm having a lot of flashbacks of types I've seen. This woman made a particular kind of hair. You know this what do they call it? I think skull cap, or so. That's what the style is called. And they used bonding glue to glue the center of the hair. By the time she removed it, trust me, there was a little patch that had come off, that the entire hair had come off. Within 2 years, the entire head had become overtaken. She did not know that she could seek help. Just that little decision that she made, just that fatal mistake that occurred, a styling decision that she took, or her stylist took on her behalf, to use a bonding glue to secure the style. As I'm speaking to you, I don't know, the hair is a mess. It is a mess, as in it has graduated to it is a mess, a hot mess. I have another child too that is like 12 years old, who her mom took her to make a particular style. I think it was one shuku like that. And there's a way that you can make shuku that it will not damage the hair. A lot of stylists don't know that. Very few know that. If your stylist knows that, lucky you. And when the hair was taken out, the entire middle became an issue. And when I saw the picture of the hair, number one, it was inflamed. Number two, it was discolored, very reddish and looking very sore. I mean, how do you put people through that kind of conditions? So that is one kind of scarring alopecia that you will come across. Another type is traction alopecia. Can fall under this, but for traction alopecia to fall under this, it would have graduated. It will not be traction alopecia anymore. Traction alopecia is the alopecia that occurs when you do tight styles and it pulls out your edges and you become the mama mileko. Now, for some people, when you leave it for a while and you apply some particular treatments, you do some stuff to it and all, and you generally take care of yourself well, the hair will regrow. But there are some people that consistently doing those styles back to back. Some people never listen. That's just it. They never listen. There's nothing you're going to say that will convince them. Because those stylists that know how to do that fine Ghana weaving that they like will convince them that it will grow back. Don't worry. I promise you that before 2 weeks, you will see that it's going back. After a while, when they begin to do it back to back, Auntie Banke, hi, Fitos boy, hi. Thank you for joining. When they begin to do it back to back to back, you see that their hair follicles cannot recover. The reason why they do not recover is generally hair around the temple and around the nape of the neck are usually very fine. When we say hair is fine, that means it is fragile, it is delicate. Most people are like that. I think I've probably come across just 4 people in my entire life who the edges, their hair edges are like the same length and thickness with their entire hair. So there are very few like that, and those ones, they are not in the majority. They are the exceptions to the rule. Most people fall into the rule of having fine hair at the nape and at the edges. So why put your hair under unnecessary pressure? When you begin to make all those styles that you pack your hair into a very tight ponytail, you weave hairs that are very tight and pulls all your face, it'll be like, let me say the Yoruba, they say, you see that oju that with your hair, that oju with your ball and end in tears. That's for sure, because that hair will not recover. I have seen too many cases. That's why I protect the integrity of people's hair at all costs. In my salon, we are stubborn. My stylist, I know that there's so many people that don't like us for that. You'll be like, this hair, you did not pick it. We will not pick it, man. What's the worst thing that can happen? You will stand up and go. We lose that money. But you will remember that Leozora preserved the integrity of your hair. So we are not after the styling. Now, having said that, when the traction alopecia has become so severe, such that it becomes tissued, that's when you see it that place is shiny and the hair has refused to grow back. After years, you'll be like, my hair has been like this for 100 years. That place has become an issue. It is scarred already. And the hair might not grow back. Before that hair will grow back, there are some procedures that will need to be done that will have to trigger a lot of things from the within, such that the hair will grow back, and then opening of the place and all that, not opening like literally opening up and all. But now, having said that, that's traction alopecia that is severe, like the type 3 traction alopecia, which is actually very, very severe, which has graduated and gone to university. There's also another type that is called frontal fibrosis. That one presents in the manner that from the ear to from the one ear to the other ear, your entire palm, if you place your hand this way, you find out that the entire front like this has gone. I am sure that you would have seen people like that. You would have seen them. I have seen a lot of them. Those ones, it has advanced, properly advanced. Like they are the ones that some people call half plots. They will say their hair is half plot. Entire hand like this. Can you see? The entire thing from ear to ear. That one is frontal fibrosis. And you see that it is scarred, it is shiny, it is tissued. You will see that this hair, I don't know, it will take the grace of God for something to happen there. Now, having said all of that, those ones, they have graduated. They have, Yaiko. Yes, they are Yaiko. It has graduated. And most of the time, they could have been caught early. But because they were listening to bad advice, and because most times, some people will be like, they will reach out to me like, I think I'm having hair loss, or I think I'm this. Okay, you cannot just think. And I too cannot just think. That is why we have something called consultation. There is consultation in trichology. It's just like complaining to your doctor that, doctor, I have stomach ache. Stomach ache can be a sign of anything in the body. It could be you have fibroid, it could be you have typhoid, it could be anything. So that is what consultation does. Consultation means that you sit down with the expert. The expert sits down, having gone through a series of question and answer, trying to narrow down a lot of things. They begin to eliminate what it is by narrowing. By then you are done answering questions and doing tests, prescribing some tests for you if you need to do some blood work and all that, will narrow down what the issues are. That is when we can talk about going to treatment. That's why we don't, when you meet somebody that knows about hair and that is an expert, the first thing they will not prescribe to you is for you to use a hair growth oil or use products. Products work. It's not like they don't work, but it cannot work for everything. Somebody that has carrying alopecia, there is no amount of oil that you put on it. The hair, there's no follicle, there's no open follicle that the oil can even penetrate into. So how does it want to work? So some people are frustrated. They'll be like, you have been wasting my time, I've been talking to you, just prescribe one oil. I will not prescribe oil because you go and say that Leonzora's oil is not working. I don't have that time. I won't waste your time. I won't waste my time. I'm sorry that it sounds harsh, but it's the truth. Sometimes we just have to take tough decisions. We just have to go the tough route for people to listen. Oils will not do it because it has advanced beyond topical application of products. So you have to listen to an expert and not waste your money. I, for one, I don't like when people waste money. When I know that it is not, that money is not what will make me become who I am. Because I will collect your money, I will spend it. And then you'll be an unhappy person and your problem has not been solved. That is why we tell you to go for consultation. Come into consultation. You will pay for it because it will take time. It will take narrowing down of it. It will take your time. It will take our time. So it's not that because we just want to collect your money. So please, do not, when you are suffering from hair loss, the first thing you want to do is do not buy products. Do not go and buy new products, buy new oils, buy this one, buy that one. No. Pause on the buying. The one you have, take care of the hair that is still remaining, and then see an expert. You must see an expert. Now, having said that, those are the kinds of hair losses I'm going to talk about under scarring alopecia. Now we come to non-scarring alopecia. Non-scarring alopecia simply means that kind of alopecia occurs that the hair follicles is not tampered with. You don't have scars, you don't have inflammation, you don't have tissuing of the scalp and all of that. Now those ones, they are usually fairly easy to treat because the follicle has not been tampered with, it has not been damaged. So all it needs is for the hair to be triggered or for the root cause to be identified and probably stopped, intercepted, so that the body can kickstart again and the hair can start to grow again. Now the first type that I have that is common that I want to talk about is the androgenetic alopecia. That's the general name for it. It's male pattern baldness or female pattern baldness. Now those two, they have a way that they present themselves. Most times if you observe, there are some men that you see that their hair begins to have, they begin to lose their hair. The men, they begin to lose their hair from the front. The hair begins to recede. It begins to recede. When it begins to recede, you see that the hair has a pattern of recession from here, from the front to the middle, and then there's hair all around. Okay, that type, we call it the M-shape hair loss. It has an M shape, such that if you look at the hair, the way the hair is from the back, if you look at it, there's hair here, M, like that. It begins to lose you begin to lose the hair from here. Some women who present that way. Now that kind of hair loss, most of the time it is genetic. So there's that genetic factor in hair loss. But the truth is, most of these things, the fact that it is genetic now does not mean that it is okay for you to start to experience it early on in life, like 20 years old or maybe even before 20, or maybe your mid-20s or late 20s. Most times they present when men and women are approaching their middle age years, like 45 plus or thereabouts. That kind of alopecia, the reason why we usually why I usually say that I'm not quick to want to say people should just say because it is genetic, it is normal. Yes, I understand that it is genetic, but genetics does not necessarily mean it has to present itself early enough. Okay, most times when it is genetic, there are things that trigger it to quickly appear. Usually maybe like stress is one major factor that triggers it to quickly present itself. So when you see that you're stressing yourself beyond normal, you see that most people now begin to go bald faster than the ages that those their parents used to go bald. Okay, yes, it is genetic, but they are now presenting earlier than their parents were presenting. So that is another kind of hair loss. That one is usually genetic. So the second one, sorry, I had to put down my notes so that I don't forget the ones that I wanted to talk about. So the next one is telogen effluvium. That one is a temporary kind of hair loss, such that what happens here is that you see that all the hair enters into as I said earlier about the hair having a life cycle, all the hair enters into the resting phase. A lot of hair, maybe like 50% of the hair enters into the resting phase at the same time, such that the hair now appears very thin. And then that thinness, I've seen a lot of this happen here. I'm in the UK right now, and I've seen like almost, I don't know what's happening in the UK right now. Like, I don't understand. Like, almost everybody, you can see their scalp. It is so evident. You can see their hair is so thin. You can see through the hair so much. The way our own hair is very thick, you can't see our own scalp except maybe the perimeters. But these ones, you can see their scalp, you can see to the center of their head. The hair is thinning out so much. And the way you will know that this one is telogen effluvium, which is different from the initial one, is that there is no recession of hairline. The hairline does not recede at all. But the hair is thin. You see that it's like something is happening. You cannot put your hands to it. You cannot exactly put your hands on it. But you see that the hair is there, but you can see through the hair. I don't know if you get what I mean, but I believe that I'm explaining as much as possible. But you see that you can see through the hair. The hair is very thin. Usually, you would see some middle-aged women too. This occurring in some middle-aged women, where you see that their hair is very thin and light. It's very thin and light. This, in this case, is telogen effluvium. The hair has just most of the time entered into a resting phase. At a large number of hair has entered into resting phase. The way you will know the difference between this and the initial one is that the hair does not recede. The hairline does not recede at all. So that is one. Then another common one, which is usually common in children, is trichotillomania. Trichotillomania is a psychological disorder where you see people pulling their hair. Most times it's children. Maybe they are concentrating, they are watching. Even some adults. I've seen a couple of adults who do it. They fiddle with their hair. Maybe they are watching a movie, they are reading, they concentrate so hard and they begin to pull on their hair. They begin to pull, they begin to twist and pull, they begin to twist and pull. That twisting and pulling motion begins to pull off the hair. It begins to pull off the hair. It begins to pull off the hair. That way, you see most of them, you see that it occurs in maybe a particular part of their hair where they are usually, maybe someone that is right-handed, and it's usually that side that she likes to pull on all the time. You find out that it is that place that is usually occurring, that there's a particular place that it's occurring at. That kind of situation, it is not something that is occurring in the body or anything. It's just a mind thing. So that person needs to see a specialist in that area, maybe like a psychologist that can talk the person out of it, or there will be things that can distract the person, or maybe some of them are given items that they fiddle with, maybe like a soft ball or something that they fiddle with at that time, so that it takes their minds away from the hair that they are playing with. Most of the time, it occurs in children. Most times, with children, it's a lot of loving, a lot of patience, and a lot of gentle talking that can help them. I've had one child like that that's come into the salon before. Her mom brought her, and we did a lot of talking, and all that. And fast forward to maybe like 2 years after, when I saw her, I think she had outgrown that phase. So that is that. Then another one that is very common is alopecia areata. Alopecia areata is called patchy hair loss. They call it patchy hair loss. This one occurs such that you see funny patches. You could see a patch here, you could see a patch here, as in the patches are sparsely distributed on the hair. Now on the head. Now, all right, okay, we are still on. So with patchy hair loss, let me see. Sorry, please, guys. Let me just see if I can. How did I not charge? I never charged my phone. I'm so sorry, please. I never charged my phone, and it's so bad. Like, it's embarrassing. I'm sorry. Okay, so, all right. Oh, good. We are good to go. Yeah. So with patchy hair loss, it presents in a way that you see tiny patches. Tiny patches, tiny patches, tiny patches on the hair. Most times it begins with just a little patch, and then you overlook it, and before you know, 2 patches have appeared. Before you know, 3 patches have appeared. This type of hair loss occurs because there's an autoimmune disorder. Something in the immune system has been interrupted. It could be anything that has caused it. Anything can trigger it. With this kind of hair loss, until that immune system disorder is corrected, the hair will not be corrected. So that is why, please, this is the reason why I tell people that you come into consultation, because we cannot just assume. And then sometimes people have a combination of 2 or 3 types of hair loss on their heads. Yes, it happens. So there are sometimes that you even look at it and be like, this thing is presenting like androgenetic. This thing is presenting like telogen effluvium. Those 2 are a bit similar. And then if you don't know, if we don't begin to narrow down, that's why we begin to narrow down and begin to look at your lifestyle choices. We begin to look at so many things. We ask you a lot of questions. We begin to narrow down. That is why it is not, we cannot just tell you that, okay. And people be like, I think I'm suffering from hair loss. Tell me what to use. No, you cannot just tell me what to use. You can't just say that. So patchy hair loss, until the immune system is jump started and corrected, it will keep occurring, and then it begins to worsen. And when it is overlooked, it becomes alopecia totalis, a complete loss of the entire hair, and it will affect the eyebrows. It will affect everywhere that there's hair on your body. So please, those are the ones that I want to talk about for now. And I don't know, what's our time? Oh, I'm sorry, we are way behind time, but we have blown our time. But having said all of this, these are some of the alopecia that I want to talk about. So please, most times, some people do not actually, some people just observe and they'll be like, or you might even observe. And for this patchy alopecia too, it occurs in men. Oh, you will see it on their beard. That's why you see some people that you see a patch of their beard, they will have this tiny patch, and they'll be like, that's how it has always been. Before you know, your beard don't go. So please, you do not, alopecia is not something that you want to overlook. Majorly not because it is life threatening, but because there's a way that it erodes your confidence. It eats away at your confidence. See, it's a different thing if you have it and decide that I want to wear low cut, I want to wear punk. It's of your own volition that you chose to cut your hair off. But when something just decides to take your hair away from you without your choice, without your consent, there's a way that it messes up with your head. Do not get to that stage, please. I hope you have found value in this little time you spent with me. Thank you so much. So next week, I'm going to be talking about the signs you should be looking out for, things you should pay attention to that occur in your hair, and then you don't want to overlook, that will trigger you to run quickly to an expert and have them look at what's happening in your hair. So please, if you feel that you're suffering from any form of hair loss, or you're seeing signs that you feel that you're not comfortable with, please reach out to us. I mean, consultation is not expensive. That's the truth. It's how much priority you place on how much worth you place on your hair that will determine whether you want to go for consultation or not. But having said that, please, hair loss is not something to joke with. The longer you leave it unattended to, the worse it becomes, and then the harder treatment becomes. Because the truth is, most hair loss cases can be reversed. They can be reversed when they are caught in time. But when you begin to look at over 5 years, it becomes tricky. it becomes tricky. That's why somebody that knows their worth will never promise you anything. We can only try, and then you will also help us, because there are things that you can do on your own end. Most times lifestyle choices correct these things. That's why we always say that let's talk to an expert. Okay, when you talk to an expert, you see that when the thing is not so far gone, little lifestyle changes can easily correct it, and then you'll be patient. You see that within a couple of months, within a few years, it is corrected. So don't be in a rush, but at the same time, please talk to an expert. Thank you so much, everyone, for joining. I've had a long day. I mean, my face even looks, I know that I'm tired, my head aches, but I do not want to have to not do this. Thank you so much, everyone. Please, if you have questions, you can drop them in the comment section. You can come into my inbox. I will answer you. And if there's anything that, and please, again, I hope you know the meaning of alopecia now. It is hair loss. It is simply hair loss. It's just the medical term for hair loss. So thank you so much. Thank you, Start Small Doctors. Thank you. That's my Oga, madam. Thank you so much, everybody. Please join us next week again, 6 p.m. Please, the whole month of August, we'll be talking about, Soft Lion just joined. You're late. We are almost done. So if we'll be talking about alopecia for the whole month of August. So please, if you have questions, please drop them. I can quickly entertain them while the class is on and everything, while the live session is on. So thank you so much, everybody. For those that didn't join and caught it late, I'll definitely be I'll be sharing the replay so that you can watch it, and I'll also post it on my YouTube channel. For those that are not big fans of Instagram, I'll post it on YouTube. I mean, YouTube is actually easy for a lot of people to watch and all. So thank you so much, everybody. Please join us next time. Don't forget, alopecia is not restricted to women. It occurs in everybody, men and women. So thank you so much, everybody. I'll see you next week. And please watch out for our posts. As I said, read our posts, read the captions, please. We always drop free tips, please. Thank you so much, everyone. Cheers. Bye.